The answer to why gums bleed is a little bit of a complex one, and yet it's very simple. A study was done in Sweden in the early 80s. 100 dental students were told to stop brushing and flossing their teeth. They were watched very carefully by the researchers over a 21-day period. As the days progressed, the gums changed from a pink, healthy look to a reddish look to ultimately the gums were bleeding profusely. They were then told to go back on their brushing and flossing again. And over the next 21 days, the bleeding disappeared completely. So what this tells us is that dental plaque that builds up when we don't use brushing and flossing is what causes inflammation, and the inflammation causes the bleeding. What worries me is that thousands and literally thousands of people accept the fact that their gums bleed and don't think there's anything seriously wrong. One needs to understand that bleeding is a symptom of inflammation, inflammation is a symptom of infection, and the infection known as periodontal disease is what causes general health problems because the infection gets into the bloodstream and affects all parts of the body. It is not a trivial sign, it is something to be taken seriously, and we need to do something about that with people who have bleeding.